Welcome to Section 10 of the Care1 online induction concerning work, health and safety. Work, health and safety is everyone's responsibility. By everyone, this means the employer, the employee, the care recipient, members of the public, other clinicians, and other stakeholders. Everyone plays a part in ensuring that the work health environment is as safe as possible for everyone involved. You are entitled to a safe workplace. Whilst working for Care1, you will be working in many different environments. Very few of them will be controlled by us as the employer. This adds a layer of complexity that is sometimes hard to manage. Remember, it is your workplace, but someone else's home. It is up to you to ensure that you are safe. If you believe there is something happening that is putting your safety at risk, contact Care1 immediately. Remember, you owe the person you are supporting a duty of care. When it comes to work health and safety, the main terms are harm and risk. Harm refers to the exposure to the potential for someone to experience injury. Risk means the likelihood of that harm occurring. The potential for harm always exists, and the risk is never zero. But we can reduce the risk and minimize the potential for harm. You must report any workplace injuries, actual experienced harm, and risks where this is a high likelihood of being harmed. This reporting may vary based on the level of potential for harm and the likelihood of that harm occurring. Reporting options include contacting the Care1 on-call team, contacting the Care1 office, and contacting emergency services. If Care1 are not informed of any unsafe or high-risk environmental factors, then nothing can be done. As the risks are often at the care recipient's home, the ability to respond may be limited. But what can be done is providing staff with extra resources to work safely and/or encourage the care recipient to change the environment to something less risky, or to work with the care recipient so that the risks can be lowered. As your employer, Care1 will provide necessary training if there are specialized tasks to be completed, personal protective equipment, and clear direction and instructions on what to do. Infection prevention and control. Care1 is committed to promoting effective infection prevention and control for all clients and a safe working environment for all attendant care workers in our community settings. We have learned many things through the COVID-19 pandemic, and one of the biggest lessons we have learned is that viruses like COVID-19 are spread through poor infection control. Everyone has a responsibility here, as influenza, COVID-19 and other diseases are transmitted through infecting others. Coughing and sneezing etiquette asks to cough or sneeze into your elbow or tissue. Clean your hands after a cough or sneeze. Use disinfectant as required and as appropriate. Effective cleaning in high-risk and high-traffic areas will reduce the spread of infection. Hand hygiene is critical. Wash your hands regularly and thoroughly, especially when providing personal care, mealtime assistance, housework, or touching pets. Managing sharps is a very important thing. In some high-risk lifestyle environments, illicit drug taking, and in some clinical events, diabetes management, sharps will be present. If the environment you're providing care in has sharps present, there must be a safe and effective method of disposing of sharps. If there isn't, contact Care1 immediately. You may be involved in food preparation and handling. In such cases, you must practice safe handling strategies, keeping hot food appropriately hot, keeping cold food appropriately cold, managing hand hygiene, cross-contamination of food such as raw versus cooked food, effective disposal of food, effective storage of food, and managing food expiry. Hand hygiene. Hand hygiene is considered the most important infection control measure used in a care recipient's home to prevent and reduce the spread of infection. Please thoroughly wash your hands with soap and water for 20 seconds when you are around food, pets, handling liquids, equipment, and when you are touching other people. There are 5 main moments that should trigger you to wash your hands: before touching a care recipient, before any procedure or event that involves direct contact with the care recipient or where there may be a risk of contact with bodily fluids, after a procedure or possible contact with bodily fluids, after touching a care recipient, and after touching a care recipient's surroundings, such as laundry, crockery, personal hygiene equipment. PPE or personal protective equipment. The main reason we use PPE is to act as a barrier from diseases and viruses. Diseases and viruses can be airborne and transmitted from person to person via air droplets or require physical contact. PPE must be applied correctly and refreshed or replaced as required between supporting different care recipients or the same care recipient in different hygiene routines. A face visor protects the vulnerable moist areas such as the nose, eyes, and mouth as a route of infection transference. Eye goggles or protection protect the eyes as a route of infection transference. Surgical masks protect the mouth and nose as a route of infection transference. Gloves and aprons reduce the likelihood of touching things with exposed skin that may then be touched by others, and this reduces the route of infection transference. You have reached the end of section 10. Please proceed to the quiz following this video.